Hello, my name is Krishana Cleveland, and today I will be going over elderly homelessness. I'm going to address the social problem, review some statistical data related to elderly homelessness, and wrap up with arguments to support and oppose elderly homelessness. As of January 2019, Arizona had an estimated total of 10,007 individuals who experienced homelessness. The elderly population is on a rise as baby boomers begin to turn 50 and 65. The anticipated growth is more than 50% of the general population and is expected to double in the coming years. There is an alarming number of individuals who are over the age of 50 and are currently homeless or have at least experienced some type of homeless situation. Elderly homelessness is defined as anyone from the ages of 50 and older who is disaffiliated, disconnected from supportive relationships and traditional systems of care. Here in Arizona, our Central Arizona Shelter Services, also known as CAS, reported to have helped 1,300 elderly individuals during 2018 and 19 fiscal year. Causation of homelessness. The lack of supportive housing for the elderly has become a prominent issue among different states. However, during this presentation, I will be discussing Arizona only. So what are some reasons or causations that leads to homelessness? Currently, elderly suffer from financial instability, lack of affordable subsidized housing, lack of family support, mental and physical disabilities, and the lack of accessible community resources. Because there are so many risk factors to becoming homeless, I will only be discussing and focusing on the lack of affordable or supportive housing. Income and housing work hand in hand. Without money, you can't afford housing. Some elderlies may have a part-time job to supplement their income, but majority of the elderlies are on a fixed income and they may rely on Social Security benefits. The average income for Social Security benefits here in Arizona is between $635 to $750 a month. Maricopa County landlords mostly ask for 3 times the monthly income for rent. 1/3 of $700 isn't enough for rent. Let's review some statistical data. The projected number of elderly homelessness is to double by 2050 from 44,172 to 95,000 individuals. From 2011 to 14, there was a 34% increase of Arizonans older than 45 and a 53% increase in homeless among Arizonians 62 and older. CAS reported that they helped a total of 1,300 people older than 55 who were experiencing homelessness. Arizona-specific housing study, the National Low-Income Housing Coalition, reported that there is a shortage of affordable rentals for extremely low income. 2018 report from National Low-Income Housing Coalition found that nationally, 1 out of 3 extremely low-income renters is older than 62 years of age. The average cost of rental in Arizona is $1,085 a month. Supporting arguments. One way to address the concerns of homelessness is providing more permanent supportive housing. Permanent supportive housing has shown to be effective in addressing chronic homelessness. Permanent supportive housing has been credited with reducing the number of chronically homeless individuals since 2006. Permanent supportive housing has been documented as cost-effective with people who have complex health and social needs. It's also multifunctional to address and assist individuals with chronic health conditions, early mortality, mental health, and substance use disorder. Supportive services like housing, education, vocational, and social supportive services are also offered. Permanent supportive housing supports housing stability with ensuring that all services are being provided through the program. It also allows individuals to age in place, gaining independence, allowing in-home supportive services that for those who are not able to be mobile and need additional care. Opposing arguments. Society does not want to be responsible to come up with solutions to help the homeless crisis. They feel like that it's a job for federal and state government agencies to come up with solutions to help in homeless crisis. America provides opportunity to all to gain employment in order to save for a retirement plan. Politicians are not promoting change to the current reforms like McKinney Veto Homeless Act to address homelessness and provide additional benefits. Slashing of federal housing and safety net programs are being conducted to get people to work and not depend on federal programs and to find a way to become self-sufficient. Statistical data for supporting and opposing elderly homelessness. Investments in the permanent supportive housing have decreased chronic homelessness by 30% since 2007. The projected number, again, for elderly homelessness is to double by 2050, from 44,172 to 95,000 individuals. It costs the taxpayer an average of $35,578 per year to help chronically homeless individuals. Some homeless individuals refuse to utilize community service programs readily available to them, so why, as a society, should we help them when they can't help themselves? Thank you.